Welcome back to our series on whiplash injuries. I'm Dr. Jake Coffman, and today we're discussing why our approach to understanding and treating whiplash injuries needed to evolve beyond the initial grading system. In 1995, the Quebec Task Force introduced a classification system for whiplash injuries that graded them from 0 to 4 based on signs and symptoms. This system was groundbreaking at the time, providing a standardized way for healthcare providers to diagnose and communicate about whiplash injuries. However, as we treated more patients and conducted more research, it became clear that this grading system, while valuable, had limitations. For instance, many patients experienced symptoms that didn't neatly fit into the established grades. Some patients with grade 1 injuries, neck pain only, developed cognitive symptoms like fatigue or widespread pain not accounted for in the grading system. Other individuals with the initial grade, it didn't always correlate with long-term outcomes. Some patients with lower grade injuries developed chronic symptoms, and while some with higher grade injuries recovered very well. The grading system also didn't account for psychological and social factors that we now know play a crucial role in recovery. Factors like stress, anxiety, social support can significantly impact a patient's prognosis. Two patients with the same grade of injury could have vastly different experiences and outcomes, suggesting other factors were at play. While the grading system helped with initial diagnosis, it didn't provide much guidance on tailoring treatments to individual patients' needs. These limitations highlighted the need for a more comprehensive approach to whiplash injuries. We needed a framework that could account for the complex interplay of physical symptoms, psychological factors, and social context that influence a patient's recovery. This realization led to the development of a more holistic model for understanding whiplash injuries. This newer approach considers not just the physical signs and symptoms, but also how biological, psychological, and social factors interact to influence a patient's experience and recovery. By recognizing the complexity of whiplash injuries beyond just their initial presentation, we can better understand why some patients recover quickly, why others develop chronic symptoms. This evolved understanding allows us to develop more effective, personalized treatment strategies. In our next video, we'll discuss typical healing times and the factors that play a role when it comes to whiplash recovery and why some whiplash injuries, even though they have a good initial prognosis, develop into long-term chronic pain, and then what you can do to help decrease that chance. I hope you enjoyed this video. Please like and subscribe, and that next video will be up soon.